Hi everyone, I'm Dr. Lin of Rehab and Physical Therapy here in Tustin, California. We have Stephanie coming in for more progressions of exercises for her knee, and so we're going to start moving things towards the dynamic performance. We're doing some things that were more static and isolating muscle groups and going from stability from the hip, the knee, and now we're going to put it together. So a great exercise is hip hinging and really understanding the whole point of that. So this is great for those who have trouble squatting, those who have trouble deadlifting. So make sure you get this down correctly, but you need all those other exercises first before you can get to this. So you can imagine doing something like deadlift is actually a lot more troubling if you don't have those other building blocks there to help you. So we're gonna get right to it. So we're back, and all you need is a very expensive medical device. Right here, you can get it at Home Depot, a dowel. So what we want to do is make sure you're setting this up correctly. You want a nice sitting height, about 100 to 110 degrees of hip flexion. So you want to go from here to here. So raise it for those of you who have different heights. Then what you want to do is, the great thing about doing this is you want to align things. And really what I care about aligning wise is the top of, go ahead and just turn a little bit here. Go ahead, the top of your spine here, base of your neck, all the way down to your tailbone. Those should touch. And if you watch how Stephanie is doing this, you kind of put the hands here so you don't grip the dowel. Okay, let's go back. And what you want to do is both feet should stay flat, about even, 90 degrees here at the knees. And then what you want to do is start hinging. And the two things that you want to avoid is overextending or overflexing. And there you go. And so if you're overflexing, these are sometimes core issues, or overextending, these are sometimes some tightness issues. So that's why those other exercises before are really important to get and stabilize. So you can watch Stephanie do this pretty well, and you should feel your stomach muscles, your core muscles. What the most important muscle that I tell everyone is that inside, that semimembranosus, semitendinosus muscle that keeps your hip in place. Remember, that hip is really important for the knee because the knee is a hinge joint, which is usually the victim of your hip and ankles. So go ahead, and once again, make sure you're doing this exercise, with the supervision of medical professional, and this is the right exercise for you. So please do this at your own risk. Okay, keep going. And so let's show everyone what the wrong way to do this is. And so a lot of people just kind of let this lift off. Okay, so go ahead and just slouch a little bit more, and they let this lift off. That puts a lot of pressure on your lower back, and for those of you who are trying it, you can probably sense that. And then the other way is overarching. So go ahead and as the other way around. So arch up, yep, and they leave a big gap here. So you don't want that gap right here. Make sure everything is nice and congruent. Not everyone can do this exercise, but once you get yourself to be able to do this exercise, life gets a lot more simpler for many of my patients. So this is the hip hinging exercise. One of the great ways, if you want to progress this and you're doing pretty well, I would just say tell people to slide one foot back just a little bit, and then go from there. And then you're gonna really stagger one side more than the other. And I always tell people you want to get to about 80% on the front knee and 20% in the back. So make sure you're doing this correctly here. And right there, yeah, doing pretty good. Just to work hard for this one, so this is a little bit tougher. And this is the knee that she's having trouble with if you go back to the mini squats. So if you go to this side, it's a lot more easier probably. So very nice. Does it feel easier?
Yes.
Yeah, so she really does have some issues here, and we're really trying to get to the root of it. So for those of you who have a weakness on one side, great exercise to do. So thanks again for coming in, Stephanie. I'm Dr. Lin of Rehab and Physical Therapy. Remember, every Monday and Thursday we're pumping out some new videos. They're very exciting, of all sorts of topics. Leave a like and comment if you have any questions or want us to do some interesting videos. And if you're new, please subscribe. So once again, Dr. Lin, Stephanie, remember, we can and we will get better together.